Good afternoon, and thank you once again for joining me for a new segment of Direct with the Director. I'm Greg Foster, Nassau County Director of Emergency Management. Well, our first holiday of the season is behind us. As we all know, there was a lot of concern about the gathering with family and friends for Thanksgiving expressed by the CDC and other health experts because of the surge of positive cases in every state in the country. Unfortunately, we'll have to wait another week or so before we will be able to determine if Thanksgiving celebrations will dramatically increase our number of positive cases, particularly the percentage of positive cases against the number of tests conducted. In Nassau County, the trend of higher percentages of positive cases we've seen is already concerning. While news about vaccines awaiting final approval by the FDA is encouraging, we still believe that it would be the middle of next year before the vaccines become available for the general public. This pandemic continues to interrupt our normal lives, but we must continue to protect ourselves and those around us, and I mean all of us, by practicing social distancing, washing your hands frequently, and by wearing masks in public until the vaccines become available to all of us. Joining me now to ask a couple of questions is our EOC PIO, Dave Richardson. Dave.
Hey, Director.
Good afternoon.
How are you?
Good.
Let's talk about what you've just said. We haven't yet seen what the expected surge in cases following Thanksgiving might be, but our percentage of cases yesterday was near 8% or 18%. We had a number of cases again today. What's this telling us? While we have done a good job in Nassau County for the most part, this is a pretty good jump in percentage of cases, right?
Right.
Well, for the first time, we're seeing more hospitalizations and people in ICU in Nassau County. This is important. This surge is happening, and we haven't seen what's going to happen next week or so after Thanksgiving. What do we do?
Well, what it's showing us is that although we don't have certain hot spots, we don't have any particular area that all these cases are coming from, that there is a segment of the population that is putting themselves out there in a manner that exposes them to COVID-19. And we need those people to pay attention to the CDC guidelines, pay attention to what the Florida Department of Health and Emergency Management is saying, to make them safer. That's the whole point of everything we're doing here.
And everyone else.
And to make everybody else safer. Yeah. I actually, in my family, I have some COVID-19 issues going on in my distance family, and it was a single case that infected many people. And that's one of the main concerns with COVID is, yes, you may be a healthy, young person who's not going to have any problem with COVID, or at least limited problem with COVID, but the people that you're around may be much more vulnerable than you, and you may be taking it to them and exposing it to them, especially during these holiday times that are going on. I was asked a question the other day in reference to, is the large number concerning to you? And one is concerning to me. This is a pandemic. It's a serious thing. I know that there's a lot of misinformation out there, but ultimately it is a dangerous disease, not to everybody, but it is dangerous to a segment of the population. And the people who may not be at risk are carrying it to the people that are at risk. We're seeing that it's family household transfers of the virus. We're still seeing limited spread in schools. Most of it is home transfer. So we just need everybody keeping in mind that is the point of this, is to not only protect yourself with wearing a mask, socially distancing, proper hygiene, but also protect those loved ones around you that might be more vulnerable.
And for our healthcare workers, I mean, this is an issue because we're seeing hospitalizations increasing across the country, including Nassau County now. We've got people in ICU. We had some people going down to Duval County, but now we've got people in the hospitals here.
Yes.
So we have to have a concern that our healthcare system is obviously being stressed,
right,
and we as individuals are the only one that can slow that process down, correct?
Sure. That original shutdown that took place at the beginning of COVID-19, the whole purpose of that was to avoid having the healthcare system get overloaded with people and basically crumbling because there's just too many people that need that extra care in the ICUs and the hospitals. Not that we're getting to that point, but that is obviously a concern that if we continue with large numbers of people coming up positive, the more people you have positive, the more likely you are to have people in the hospital and in the ICU, and we don't need to tax our health system like that.
One of the other issues is for the Florida Department of Health. They do contact tracing, right? Sure. And we had 70 cases yesterday, 51 cases today.
Yes.
That's a lot of cases for Nassau County. We haven't seen those kinds of numbers during this pandemic, and our fear is after Thanksgiving. So a lot of contact tracing will be a follow-up, correct? Sure. So absolutely. How does that work? And what should people do, and what are their expectations? Will they get a phone call from someone?
That's a very good question. Obviously, the Nassau County Health Department or Florida Department of Health in Nassau County has done a phenomenal job with contact tracing, a lot better than other parts of the state and country in reaching out and making sure people understand what they need to be doing and that may have been exposed. But there's only so much that the Nassau Department of Health can do because they have limited numbers of employees, of people that can do contact tracing. I've been advised by the Department of Health that they've had to reach out to the state to get some assistance in contact tracing through epidemiology at the headquarters office. So I've got a couple of numbers that people in Nassau County may receive a call from. And I know in today's day and age with a lot of spam calls, a lot of people trying to scam people, that people don't like answering the phone. But if you get a call from one of these numbers, it is the Florida Department of Health in Tallahassee, and they're trying to get a hold of you either to tell you you've been exposed or give you further information in reference to COVID-19. And those numbers are 833-917-2880. Second one is 833-443-5364. And the last one is 850-583-2419. And we're going to release those on social media also and put it on our website, so if people didn't get it.
Right. We'll post those as soon as we get through here, right?
Sure. Absolutely. And there is a possibility that there may be other numbers, local numbers that are fed through the phone bank there. If you get a call from somebody, they advise they're from the Department of Health and they want information or to give you information, and you're concerned that it might be a scam or somebody that's misportraying themselves, you can call 904-875-6100, and that's the main number for the Nassau County Department of Health, and they'll confirm if it's actually somebody who's calling and they're on the up and up.
Right, okay.
When they do get that call and they're ordered to be under quarantine because they've come in contact with somebody, it's expected that you will quarantine. There's a reason for that. Again, to stop the spread, to protect yourself, and to protect others. So you've got to stay at home. You've got to stay away from work. You've got to stay away from other people as much as possible. If you live with somebody, a husband, a wife, a boyfriend, girlfriend, or children, stay away from them as much as possible. Have a room that you're staying in, and if you live alone and you need groceries or food, utilize one of the many services that are out there, either from the store itself or the number of services that are out there to do deliveries. Okay.
Well, we'll do this again next week, obviously.
Absolutely.
And we'll have better information on what, as a result of Thanksgiving, the holidays. We're going to go into a couple of more holidays toward the end of the year here. And we'll also maybe talk about vaccines, because people are going to start hearing more and more about the shipment of vaccines to states. And we'll want to discuss next week how people in Nassau County, how they will get a shot, when that shot will be available, who's going to be first, all that. So we can talk about that next week.
Looking forward to it.
Thank you, Director.
Thank you.